escalators and de-escalators, and things that you can kind of incorporate into your communication with other people. I'll explain what that third Roman numeral means, your brain in the basement. And then finally, I'll touch a little bit on the principles of what's called interest-based negotiation, which is basically a field of conflict resolution negotiation that it's actually a term that's come out of specifically healthcare conflict resolution. And we'll actually talk about some practical, like in some ways kind of technical suggestions about things you should be mindful of when you're communicating. So the dysfunction that comes with the territory, we deal with a high burden of conflict. It's part and parcel of the arena in which we work. The shared interests that we have often get compromised because of conflict that ends up being between the two departments. And the typical situations are, to admit or not admit, territory. We deal with a high burden of conflict. It's part and parcel of the arena in which we work. The shared interests that we have often get compromised because of conflict that ends up being between the two departments. And the typical situations are, to admit or not admit, appropriate patient workup, appropriate patient treatment and stabilization, appropriate admitter for the patient, which is probably a bigger one than it should be locally. Speed of disposition, similarly, is a big issue, and handling of an uncooperative and usually physically absent third party. Those are, I think, the bullet points of, you could probably capture about 90% of the angst between ED and hospitalists in those 6 categories. So, factors that we share, we both deal with a very high acuity of care. Nobody comes to us because they were scheduled to come here and they're feeling okay. Everybody who comes to see one of us is coming because they're in a crisis of some type. The work takes place at a high stress level. We see people at their worst physically, mentally, emotionally. There's a high priority placed on the speed of work. You're expected to do everything perfectly and do it very fast as well. And so there's always a trade-off with quality, and I think that the fact that by having to move at a certain pace and then having to answer to a certain level of scrutiny, actually that's
okay, you can see it there. Thank you.
You know, it's something we always have to do, and we have to manage that conflict, and it's rarely acknowledged. And then we're in-house 24/7. Everybody knows we're in-house 24/7, and so that's a privilege of others that often gets abused. ED and hospitalists are the consummate generalists, so we deal with everything. We don't know what it is before it comes to us. We don't have our cases vetted for us really in terms of what's coming in, and there's a high degree of uncertainty in what we do. And then we, as a consequence of being generalists, have a high need to rely on specialists who often don't want to hear from us. You know, we have periodic bursts of unmanageable workload. More work than any one person can do will be on your plate from time to time, and it can be feast or famine, and that's not preventable. And then finally, we have to live with one another because we deal with one another 24/7 every day. So to talk about it in the way that I've talked about it, I think emphasizes a lot of the negative aspects of these shared factors of our job. You could very easily turn this around and you could look at each one of these bullet points from the standpoint of it really being a positive aspect of our job. You know, the high acuity of care is what makes the job exciting. The fact that we're uniquely qualified to deal with the stressful high acuity work makes us indispensable to the system. There's a high value in what we do, and we should know it. We're some of the most productive workers in the entire healthcare system. We see the stuff that nobody else gets to see. We can deal with it more competently than anybody else. And we actually have an opportunity to engage each other in professional collaborations that are probably beyond what we're able to do with a lot of other specialists, because the level of iterated involvement is just not there between, say, you know, me and an ENT doc, or me and somebody else who we might encounter each other once every 100 cases. So, conflict escalators. You know, conflict is inevitable, but what makes it escalate, and what makes people get angry, what makes people not function? Yeah, Mel Gibson, not a role model in more ways than one. So these are the conflict escalators. Simplification. What's wrong? That guy's an idiot. He's trying to kill my patient. That's the kind of statement that you might characterize as a simplification. Emotion. You know, where you just have had it, you go, what the expletive do you want now? That outburst. Polarization and enemy image. You know, all they ever do is dump on us. Investment in or humiliation. Let's get that one. The statement that was actually made. Did you actually go to medical school? That was a member of our medical staff actually said that to one of our ER docs, not knowing that it was the director of the ED when he made the statement. Investment in conflict and sunk cost. You know, this classic situation where we've been arguing now for 3 hours, so at this point I have to win. I have to do everything possible to win. And then obsession with winning. I mean, it's sort of, if people know the old Warner Brothers cartoon with the Bugs Bunny and Daffy Duck, and they're arguing over whether it's rabbit season or duck season, while Elmer Fudd is holding a gun going like this. And they basically become so obsessed with the one person saying that, no, it's duck season, that they really sort of lose perspective on the fact that what they're actually trying to do together is not get shot. So I think we end up, it's a metaphor for a lot of what we do. So what de-escalates conflict? Again, cannot overemphasize Mel Gibson, not a role model. Cordial, collegial, face-to-face contact makes all the difference in the world. You can say stuff to people when you're angry on the phone that you would never say to their face. And so it really humanizes people to be in the same room together, to have eye contact. One of the other things that it allows you to do is give perspective on the situation. Often the cases that we deal with, the clinical situations that we deal with, and the differences in our priorities as ED versus hospitalist, if we just sort of were able to engage each other talking about what's going on for a little bit longer, it would really actually help us to sort of see around the hospitalist's view versus the ED doctor's view of what is often a really complex situation. Cooling off time makes a very big difference, especially when you're in that period of time where you've had an unmanageable workload placed on you. Just to be able to sort of reset for 5 minutes or 5 seconds or however long it takes is often enough to really save yourself from doing something you regret. Apologies, so if you do fly off the handle, or if you're really stressed, and you can say, listen, I'm sorry if I snapped at you, or I'm sorry if I seem edgy, but I'm really under the gun right now. That makes a difference to the other person. Granting somebody an opportunity to save face, we all have had a clinical lapse, or made a clinical mistake, or had something change up on us that we didn't expect. And I think that if you give that person an opportunity to just sort of own up to it and you move on, I think it makes a big difference. The willingness to settle, and then the shared savings that can result from de-escalation. I think, in some ways, we haven't created enough opportunities for us to get together, settle our differences, and actually benefit from it. But the fact is that those benefits to the system are there. So, everybody's with me so far? All right, so why is it so hard to actually de-escalate conflict? Why is it so hard to avoid escalating conflict? Well, as as I've been told by many, there's a problem with your brain. And this is a very crude, look at the human brain. But basically, it can be divided up for the purposes of this exercise into the higher cortical function, the sort of middle brain functions, and the lower or primitive brain. What actually in some of the books you'll see them call it the reptilian brain. So your higher brain, your cortex, is really good for creativity, for organizing data into new patterns. Your middle brain is actually good at habits and acquired patterns and things that you learn like driving a car. That you don't have to consciously think about them, but they're not things necessarily that you were born with, and they're new skills that you can acquire. The lower brain is devoted in large part to primitive survival patterns, so that's fight, flight, or freeze. And so that's what we call the basement. And so what happens to any animal, person, whatever, when they're put under conditions of severe stress, is that it's unavoidable that for a period of time they go to the basement and they revert to patterns of fight, flight, or freeze. These are unavoidable physiologic and psychic responses to stress. Frequently causes people to abandon a planned and logical script and adopt a reactionary stance. So something very stressful gets right in your face and you go to the basement. So just think back to sort of your inner monologue where you're driving, you're in heavy traffic, you have to get someplace, you're late, and someone just blatantly cuts you off. You can sort of relive that very easily, and I guess the question is, what if you actually said or did the things that you're thinking in that moment? Generally not pretty. So the response or the decision that you'll make when you're in the basement is the one that you are most likely to regret. At the same time, you can't avoid going to the basement, so the question is really how deep in the basement you go, what you do while you're there, and how long you stay there. So the first thing is knowing and acknowledging that you're doing it, and the fact that you're always going to do it. So the management of insult, crisis, or stress has to start with being mindful of the initial basement brain response, and then getting away from that response by resetting the brain and proceeding again. And so this is something that employs the toolbox of your middle brain. It's not a one-size-fits-all solution, but it does involve your having to do some thinking of coming up with some kind of acquired pattern that you revert to, something that you do that sort of arrests the process of your being in the basement once you've gotten there. And you take that cooling off period, you do what you need to do, but you don't have a reaction that comes solely from the basement. You have to leave the conflict, mentally go somewhere else, and then re-engage. People who have any involvement with mindfulness activities know about this. It takes a lot of discipline, and again, it's got to be very individualized what you do. So my solution is that I picture my kid being in the room when I'm talking to people. Would he want me to react in a way that comes solely from the basement? Would he want to see me talking to people in that way? It's not the kind of thing that's going to work for everybody, and I think everybody has sort of a different set of triggers and a different set of responses. But just to know and be mindful of the fact that in the territory that comes with world of work, it's going to happen. You have to have a way of dealing with it. And I'm not saying that you just lay down and cede your position either. It's, I think, helpful to do this, and you are going to have to stick to your guns in a lot of situations, but you want to do it in a way that's productive. So I want to go into a little bit of the principles of what is called interest-based negotiation. This is sort of an offshoot of what I've been talking about so far. Basically, when you're in a situation where you're managing conflict with another person, you want to determine what you're trying to accomplish. You want to determine what is fair, and this is where having established ground rules is helpful. Being in the wild, wild west is not, and that's something that institutionally we're trying to work on. You have to determine your relevant experiences, concerns, fears. Be honest about that. And then you allow each party to express its own self-interest freely. I think that conflicts are often perpetuated when people feel like they can't openly share what their own interest is in a given situation. In healthcare conflict negotiation is this phrase, walk in the woods, which was Lenny Marcus, who is with the School of Public Health at Harvard, has written this book, Renegotiating Healthcare, which is sort of a landmark in healthcare conflict resolution. And his anecdote that he sort of reverts to a lot is this walk in the woods concept. And it comes from one of the famous stories in conflict resolution literature in the nuclear disarmament talks that were taking place during sort of the acrimonious height of the Cold War. And so there were negotiators from the US and from the Soviet Union trying to talk disarmament in Geneva, Switzerland, and they were at a hopeless stalemate. And both sides were sent there with a very clear directive of you have to win, you know, X objective. And they just got totally sick of it. They decided to stop. And they basically just went out and they took a walk in this beautiful forest that the meeting had been set in Switzerland. And they started to talk about the fact that it really, to them, felt like the stalemate was worse than anything that they were sort of negotiating toward. That for them, the stalemate was unproductive and draining, and that what they were really sort of fighting for was something where if there was an element of sacrifice, they had a better chance of leaving that negotiating table with a good outcome rather than being dead set on the things that they had been told they had to negotiate for. And it doesn't always work. And you may not reach an amicable solution, but the key thing is that you'll not have made the fateful tactical error. So if something is unwinnable, it's going to be unwinnable, but you don't want to shoot yourself in the foot. So I want to just shift gears for the last part and talk about some more practical tips. And some of these are useful because they're not totally intuitive, but they're things to keep in mind when you're managing conflict. First of all, learn to recognize what you do when you go to the basement. Your own physiologic and psychic responses. Not everybody sort of knows how they look when they're getting upset or getting stressed. For most of us, our spouses will oblige us if we need to know from somebody else what that looks like. But really, you can ask others if you don't know yourself, but it's kind of good to be aware of what you know and what you do. And then avoid overreading signs of emotional state in other parties. What might make someone look pissed off or standoffish or dismissive to you may not actually reflect that person's internal state. So often, a lot of misunderstandings escalate when you read too much into how somebody's body language is or what they're doing or you know, how they might be acting. You know, you have to, in some ways, take what people say to you on face value, and a lot of the other cues, you know, it's not that you ignore them, but don't overread them. Be aware of the value of turn-taking in conversational style. So no matter how critically important and totally brilliant your own thoughts are and how urgently you feel you need to get them all out, when you're talking, you need to insert some kind of a pause that provides somebody else a cue to be, you know, that they're invited to get their 2 cents in as well. If you're just basically talking a whole wall of text at somebody, it has a way of putting people off. And then finally, often it's a good idea to match the other person's style, particularly, you know, people can be very touchy about the notion of eye contact. So if you look at what somebody else does, you can often tailor what your approaches to theirs, because if some people, when they're in a stressful situation, they might be put on edge a little bit more by somebody just staring them down. And in that situation, you look at what they do, and if they don't really, if they're shying away from eye contact, it's not a good idea to like get right up and stare like through, like you're doing a fundoscopic exam on them. It's not going to keep them at ease. So those are just sort of simple tips that are sometimes helpful. And again, these are sort of things that are adjunct to the substance of the communication. Often you're going to be in a situation that isn't easily settled, and this is not necessarily to fix that, but more so to determine, to make it so that you're basically not escalating conflict that doesn't have to be escalated. So I'm going to wrap up the PowerPoint here and just tell you that most of this is stolen from Lenny Marcus's book and some lectures that both Brenda and I attended at the Society of Hospital Medicine last year. And I'm going to just open it up to whatever discussion, feedback, or reflections that anyone has on all of this. Actually, I'm going to ask Yao, how do you do it?
What?
How do you do it? Because like I haven't seen you angry in 7 years.
I do get angry. And we do have a quick discussion about it, then we de-escalate, and then we take care of the patient. I mean, I think, I don't think I would model for anyone or anything per se, but I think with everything that we're talking about, I think most of the people in this room are probably not the people we should be talking about this. But I think most of the time, if you put the patient first, I mean, and that's what you always try to do. The best interest of the patient first, I think you never go wrong. And when we talk about everything that we do, I think that's always the case. If we put the best interest of the patient first, I mean, regardless of how angry you are, just think about that person as your mom, grandmother, whoever it is. You can't go wrong with that.